Hello, here we will see the surgical procedure of doing lingual frenulum surgery. We can call it tongue tie also. In this video, we can see a person who is unable to open the tongue fully. So here we will do a surgical procedure. First, we will give anesthesia in the lingual frenulum, floor of the mouth, and the tip of the tongue, so that we can hold the tip of the tongue with a needle and suture material. It will help us with the tongue fallback and the movement of tongue. After that, we will hold the lingual frenulum with a needle holder or needle holding forceps to keep it in position. It will help us to cut the frenulum. We will cut the frenulum with the blade of 15. We will cut gradually, step by step, so that we do not hurt any muscle or floor of the tongue. We will soak it. We will use suction to suction. We will cut the required amount of frenulum step by step, so that we do not harm any muscle or any part of the tongue. We will check the proportion of the tongue coming out after gradually cutting the frenulum. Minimal bleeding will be happen. It is a surgical procedure. If we do it in laser method, there won't not be any bleeding. After cutting, we will clear the floor and check if there is any remaining frenulum. We will cut it again if there left any. Then we start stitching the frenulum again. We will use 30 Vicryl for stitching the tongue. After 10 days, we will stitch off the stitches. We are doing this is in surgical stitching. Doing required amount of stitching, probably 5 or 6 stitches needed. After stitching, we will remove all the blood stains and the holding suture of the tongue that helped us to hold the tongue and helped us to stitch and cutting. Alright, after that we can see how much the patient can push the tongue out of his mouth. Just immediate after surgery, we can see the result. Here we can see the result. The patient is painless and the tongue is longer than before, coming out longer than before. It is a painless surgical procedure. Hope you all like it. Thank you. Here is the final result, before and after picture.